This episode is brought to you by State Farm. Knowing you could be saving money for the things you really want is a great feeling. Talk to a State Farm agent today to learn how you can choose to bundle and save with the Personal Price Plan. Like a good neighbor, State Farm is there. Prices are based on rating plans that vary by state. Coverage options are selected by the customer. Availability, amount of discounts and savings, and eligibility vary by state.
Well, hello there. I'm Nurse Mo, and welcome to Mo's Monday Minute, a shorty episode of the Straight A Nursing Podcast, where I share a quick tip you can start using to improve your practice or habits right away. For more in-depth episodes, come and hang out with me on Thursdays. So today we're talking very quickly about something that can exacerbate MS symptoms significantly, and it is something that is super common. And that, my friend, is heat. Many people with MS have heat intolerance, which is manifested as a worsening of symptoms when exposed to heat, and this can include when they have a fever. Even an increase of just 1/4 to 1/2 a degree can further impair electrical conduction in those demyelinated nerves. So when symptoms worsen with increased temperature or exposure to heat, this is called Uthoff phenomenon. And I hope I said that right. It's spelled Uthoff, Uthoff phenomenon. So if your patient who has MS has a fever or gets overheated or it's a super hot day, whatever that might be, cooling them down can help immensely. So cool them down and then reassess their neurological function. And here is just a little quick tidbit. Because heat can exacerbate those symptoms, there used to be this hot bath test that was used to help diagnose patients with multiple sclerosis. A person who was suspected of having MS was immersed in a hot tub of water, and if they had a worsening of symptoms, then that was taken as evidence or indicative of the patient having multiple sclerosis. So just a little historical fact there for you. So again, your patient with MS, if they have a fever, treating the fever, getting that Tylenol, what have you, that antipyretic on board, using cooling cloths, fans, running cool water over the wrists, things like that can really help to lower that body temperature. So I hope you found that this short, quick episode helpful, and I will see you again very soon. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Have you ever wondered what the science says about certain foods, products, or treatments? Does chiropractic actually work? Should I only buy organic foods? Are GMOs actually harmful? Is adrenal fatigue real?
We've got you covered. The goal of the Unbiased Science podcast is to dispel misinformation and misconceptions across an array of science and public health topics. We love to debunk myths and help arm our listeners with information so they can make evidence-based decisions. Make sure to tune in to the Unbiased Science podcast to get all of your questions answered.